This is a patient in her early 60s that is coming to have a fat liposuction and fat transfer, mostly for the reshaping of some cellulite on the butt. And between other things, we are doing the fat transfer to the hands. One of the signs of the aging on the hands are these deep grooves between the fingers, interosseal spaces, and the volume of the hand is kind of lost. So we are going to inject probably about 12 to 15 cc's of fat grafts in these spaces, just to give some youthful fullness. And people usually see some difference in the texture of the skin because a huge amount of stem cells is transferred with the fat grafts. So we believe that effect of rejuvenation of a skin tone and texture is definitely the result of that stem cell simulation and growth factors that come with the stem cells. So we are going to give a small anesthesia for the hand and then proceed with the injections. We are now starting to inject these small cannulas less than 1 millimeter. I use different sizes, and I'm injecting deep just over the muscles and superficial fascia of the hand. This is not the procedure that should be done by people that are injectors or claiming that are big in fat grafting. It would require some basic knowledge of the hand's anatomy and how to avoid complications, because there are so many superficial veins in this area. That's one of the major complications of fat grafting, is a lethal outcome in some patients because the fat graft comes into the vessel and gets soaked there and then ends up in the heart or in the lungs and creates the embolic events that we cannot preclude. That is something that nobody wants to happen, but it does happen. So we are putting this small 1 cc, a smaller cannula, doing the deep in the space between the tendons and deeper than our major vein system of the hand is. So it's really very deep above the muscle of the intercostal spaces, and then I spread that fat so that it has a more uniform dispersion, because this is the area where we want to really spread and fill it up, interosseal spaces. And every time I additionally disperse this fat blab to give it a more uniform distribution in the area, because this is a very loose tissue, so that can easily stay in one location without moving around, and that will create fat deposits that wouldn't look good. So now I'm going to knead the tendon. That's how deep it goes to be safe from damaging the veins, and still deep in these spaces. This patient is in general anesthesia because she's having another procedures done, but generally this can be done routinely in a local anesthesia, just with the wrist block, no pain involved in the entire procedure. So we have injected around 7 cc's. There is already change in these areas. We're probably going to inject close to that, a little bit deeper towards the wrist. You cannot see the tip of my cannula as I'm injecting this fat. It is already much fuller. Of course, about 50% of this fat grafts is going to diminish, maybe even more, because the hand moves all the time, and a major aspect of take of any graft is immobilization, preventing movement. We cannot afford that with the hand, so I always do a little bit of over grafting. It has a little bit more volume than needed, because I know that significant amount of that is going to be resorbed in time because of the movements of the hand. So that's pretty much a procedure that is done. It takes about 6 months for fat grafts to settle, to take. That's really the time when you can say pretty much what is there. Very rarely we have to do some additional grafting. About 60% of patients are happy with the one treatment, maybe 10% come back for additional treatments. It's a nice, youthful looking hand with fullness. For those people that are interested in rejuvenation of the hands, that's a nice procedure that is mostly done in a local anesthesia. I will show you her post-operative result probably about 10 days and then 3 to 6 months after.